Good morning, everyone. All right, this is COVID critters and coffee, or coffee COVID critters, whatever comes first for you guys. So we're doing something a little different this week, which I'm really excited about. I'm Dr. Katie Woodley, the natural pet doctor, and we have this going on different platforms this morning because wanted to reach a few different audiences and make sure we're answering your questions about anything COVID coronavirus related, and also make sure that we're taking care of you guys on this beautiful Saturday morning here in Colorado. It is April 25th, 10 a.m. in Colorado. So when I go through all of this, I want you guys to be able to comment below or ask a question, because we're going to go through some questions and answers at the end of this. And so make sure as we talk about some of these things that have come up in the past week, what questions do you have? Maybe you have a cat and you're concerned. Why are you here this morning? Like, I'd love to know why you came. Maybe you're worried about your pet's health. Maybe you're worried about your own health. Maybe you're worried about your pet's getting sick from you. I mean, there's a lot going on. There's a lot of fear in the world right now surrounding coronavirus. Yes, in the US, some of the states are planning to open up, but does that necessarily mean that it's super safe for us and that we're not going to get sick? Those are all questions that are yet to be answered. And realistically, most of us are going to come into contact with this. That's a realistic thing that we need to expect. We need to be prepared for. And so let's talk about how we can do that. And also, if you're worried about your pet being sick, of course, there are family members, right? So we want to be able to do everything that we can to help them stay healthy. And if you're here through a holistic way, right? That doesn't mean conventional medicine doesn't work. Doesn't mean that we don't use conventional medicine, but we can integrate more natural, more holistic ways of living and health to optimize our health and our pets' health so that we can keep them from getting sick. So let's get started. What is coronavirus? What is COVID-19? Everyone here hopefully knows what that is by now. It's been going on for a few months. It's been all over the news. It seems very, very scary. And yes, there's some reason to be, worried about it. However, fear is not going to get us anywhere, right? So let's talk about what we can do. So coronaviruses are, COVID-19 is part of the coronavirus family. And it's a large family of viruses that typically infects cattle, camels, bats, and cats are part of that. So there are lots of different types of coronaviruses, and in cats particularly, there is one called feline infectious peritonitis that is caused by a coronavirus, and it can make them really sick. And so that's one of the things that we're starting to see now as the news is showcasing this week. 2 US cats were tested positive for COVID-19. That's something to be aware of. So in the previous weeks, what we've talked about is the numbers and how those have changed. And so what were the numbers last week? So last week, US cases, we were at about 712,000 cases. Now we're approaching 1 million. Okay, those numbers seem really big, and they are big. However, those are just tested numbers. So there's not enough tests out there, and those numbers would actually be a lot higher if we were testing every single person that felt unwell. And remember, there's asymptomatic carriers. And what does that mean? That means that people have the virus and they're not showing symptoms, but they can still spread the virus to other people, which I think is one of the most scary parts of this thing, is that I can feel fine. I go and visit my grandma and she gets sick, and then she dies from it because she's in that elderly population that is more susceptible to the virus. So these are things we have to keep in mind about this COVID-19. It is highly infectious. So the infection rate is typically like one person that gets it spreads it to 3 other people, which is a high rate of infection. And that's why it's spreading so quickly, so fast. And that's why they're shutting down countries and states to limit the movement of people of spreading this disease. So globally, where are we at with these numbers? So last week we were at 2.2 million confirmed cases. So keep that in mind. Those are tested cases. And this week we're at 2.8 million. So the numbers are continuing to rise. People are still dying from this. And thankfully, there's a lot more ventilators. We're managing that piece, but there's still, like, when we look at New York State, those hospitals are like slammed. People are dying left and right because there's not enough ventilators. There's not enough, we don't have a cure for this. We don't have a treatment for this. We're treating symptoms. And also what's happening, so there's a lot of like case studies coming out from this. If you think you're young and you're safe, think again. There's a lot of actual cases that are showing that people are throwing blood clots. So people my age, people younger, and what does that mean? So you can have a stroke, you can have a blood clot. That is not a good thing to have. And to be honest, that actually happened to my dad at the start of this month while Finn was going through all of his stuff. So it hits close to home. So all the people that are like saying this is not a big deal, why are we shutting down? It is a big deal. And guess what? He wasn't tested. We have not confirmed he's COVID positive. Most likely he was from the symptoms. However, these are things to keep in mind. It presents very interesting. If you lose your sense of smell, this can be one of the first symptoms that you see that you have most likely COVID. It affects the neurological function of your body. It does crazy things to your immune system. You might hear cytokine storm. So this is a big deal that we need to be aware of. So how is COVID spread? It's spread through respiratory droplets. So say I sneeze or I cough and I don't sneeze or cough into my elbow or my arm, those droplets can spread usually 6 feet. So that's why we have this social distancing for 6 to 10 feet where we need to be apart from people. And if you're out in the public, you need to be wearing a mask. That's going to stop the spread and for you potentially infecting someone else. So that's why it's really, really, really important to wear masks. So you're protecting yourself, you're protecting other people. Even if it is just a cloth mask, it's going to make somewhat of a difference. It may not keep you from getting sick, but it's going to do a lot better than not wearing one. So it can live on surfaces. So typically non-porous surfaces, the COVID-19 is going to survive longer on. So a porous surface would be like paper money or your pet's fur. So they don't know how long or if it can be spread through your pet's fur. So if you come in, like you sneeze or you cough on your dog or your cat and it walks over to like your husband and they like pet it and then they touch their face, that's a potential spread. So keep that in mind when you're feeling unwell. You could potentially being a foam, like a vector to spread it onto your pet, they come into contact with it. Why is that important to know? Okay, most of us, okay, in the US, there are 330 million people that are in the US. And most of us have pets. So the dogs, cats, like just domestic pets. And if our pets are serving as a fomite, they can actually spread it. So if your cat goes outside and you're sick, it can spread it. If you're sick and you're walking your dog or your partner takes your dog for a walk and there's potential virus on it and someone pets them on the walk, you can potentially spread it. But here's the thing. One of the number one questions I get asked is, can my pets get sick and can they spread it? So that just answered, can they spread it? Yes, potentially, we're not sure. Can pets get it? Yes, they can. So 2 cats in the US tested positive. There was a cat in Belgium that tested positive. And those cats showed symptoms. They recovered, but they showed symptoms. There's been 2 dogs that have tested positive too, and they didn't show symptoms. They were in contact with people who had COVID and tested positive. And there was also a tiger at the Bronx Zoo that was in contact with a zookeeper that tested positive. So this is very, very important to know because cats tend to seem, they seem like they can actually contract it and get sick from it. They replicate the virus more readily. There is no evidence right now that our pets can transmit it back to us. So that's really important to know because this is not an announcement to go and drop your pets off at the shelters and the rescues. Please don't do that. Like our pets are huge parts of their family member. They do a lot for our health and our healing and our stress levels. So don't take them to the shelters. However, keep in mind that we need to know that we can make our cats sick. That's really important to know. I don't want to make my cat sick because I didn't wear a face mask. So when we talk about social distancing and isolation, so if you're feeling unwell, you may not get tested. And so if you're not getting tested, you won't know if you are positive. Most likely, in like right now with everything going on and the number of cases, you probably have it. And what you want to do is isolate yourself from your family in the house and isolate yourself from your pet if you can. Now, if you're the only one there and you have to take care of your dog or your cat, or you have a service like therapy animal, then what you can do is wash your hands before and after touching your pet. So after petting them, doing anything with them, make sure you're frequently washing the bedding, you're washing like the bowls and everything else. And then what you want to be doing too is wearing a mask. And this is inside, because it's going to limit the spread of the virus to your pet, especially if you have a cat. Be really, really careful. They've been doing so there's some studies that are coming out, and they're more like case studies at this point to showcase. We need to figure out, okay, can cats or pets spread it back to humans? Because that is super important to know in terms of controlling this. So what they've done is they've taken cats, they've taken kittens, they've taken adult cats, they've taken senior cats. And what they did is they inoculated them. So they actually gave them a really high dose of the virus through their nose. So this is not a typical setting, right? This is not normal. But what they found is that a lot of these kittens, so their immune systems weren't as strong, they passed away. So they got sick. They all got sick with a really, really high dose of COVID-19. The adult cats were able to, they got sick and then they recovered. So they got better. So please just be smart about wearing a mask and, social distancing. Even as we open up and these states open up, I still feel like personally it's too soon. And I understand like the whole economic part. There's just a lot. And when you start having family members get sick and you have elderly parents and grandparents, like I don't want them to die from it. And the chance of that happening is really, really high. So how do we prepare? How do we, this has been going on for a while. So I'm sure a lot of you guys have, been prepared. You're staying at home, hopefully in the home quarantine, limiting movement to pharmacies or grocery stores. But how do we help our pets prepare? So disaster kit prep, right? We've talked about this in previous weeks, making sure you have enough food and water for 2 weeks, at least 2 weeks for your dogs and your cats. It's the same for us, just in case we don't know what's going to happen. So making sure you have enough water, food for 2 weeks. And then also making sure if they're on medications that you have enough medications for a month. So talk to your veterinarian and ensure, a lot of times what we'll do is make sure that you have enough. There are drug shortages. There are supply chain problems. Like a lot of stuff comes from China. So you want to make sure you're prepared. We do not know how long this is going to go on for. Hopefully it settles down and this is it. But they're predicting like round after round. I saw something about 2024. That's 4 years away. I don't want to scare, but it's something like, let's be prepared. And then when it comes, it's not as big of a deal because we were ready. And so making sure you have those things. Now, if your cat or your dog gets sick, call your vet first before you go in. You want to make sure they're open. We are essential businesses. So most people are still open. They're operating though with minimal staff a lot of times, and they're doing curbside drop-offs because that's going to limit the exposure. It's still maintaining social distancing. They're still able to help and serve your pets, but call them first. If you are unwell or you have been tested positive for COVID, you must tell them. Let them know on the phone. So that way they can be prepared. They can tell you what to do. This is also important in your disaster prep kit. Having phone numbers of friends, families, and even neighbors that can help you out, because I don't know if I get sick if I might have to go to the hospital. And if I'm the only one taking care of my pets, that way you can let people know that you have pets at home, you have a backup plan, and they're going to be taken care of. So, call on these people to help you if you are sick, and they can take your pets for you. There are so many people doing amazing things right now. I think the media doesn't focus on that because there's all about fear and scaring and we're all going to die. And there's so many amazing things that are happening out in the world to help others. And I know there's plenty of people that would help you. So reach out to them, just have a backup plan just in case. And then in terms of testing, are we testing pets now? So we are testing a lot more for pets. So ask your veterinarian. This isn't something that you can ask to have done. If your pet is showing symptoms, you have been unwell or have tested positive for COVID, then that's your vet's discretion on whether or not they're going to use that test. So keep that in mind. Don't just take your pet in and be like, test them for COVID. Please don't do that. Remember, you're going to call first and ask. But if your pet's fine, you're fine. You don't need to get them tested, okay? So don't worry about that. There are no vaccines yet. There's no vaccines for people. They're working on those things. They've been working on a feline infectious peritonitis vaccine for a while through Morris Animal Foundation and CSU, which is really neat. And so they're using that research study to translate that over to the human side, which is really cool. So hopefully we get something out soon to start protecting, especially, the older population, people at risk. This may not seem like a big deal to a lot of like healthier, younger people. However, we have a huge population of people in the world that have autoimmune diseases, asthma, COPD, so many other conditions that they can't leave their house right now. So what can we do to help? What are you doing to help yourself? Are you taking the time in the morning to remember the things that we're grateful for? Stress levels and anxiety are really, really high. Have you felt anxious? Have you been stressed? Have you noticed your pet being stressed? Remember, we're all connected and our pets are watching us. And so what are some of those things that you can do to help yourself and also help your pet? So number one, routine, routine, routine. A lot of people's routines are flipped upside down right now, especially if you have children. Like you're having to homeschool, you've never had to do that potentially. You've got a full-time job to still manage and you're doing it while teaching your kids who don't want to listen to you anyways. So make sure you have that routine as much as you can. I know it's difficult, especially if you have kids and you're working, but that routine is going to get you through and it's going to keep those stress levels down. Make sure you're taking breaks every hour, 10 minutes, 5 minutes. Escape to the bathroom and take some deep breaths, close your eyes. Don't pick up the phone and consume social media. Social media and the news are really, really stressful. And so it's just a huge overload and burden, and it's going to stress you out even more. And then guess what happens? Our pets see that, they feel it, and they get stressed. Who's ever noticed, like when you're stressed, so let's say if you have a sensitive GI system, right? Let's get real here. And you get like diarrhea when you're stressed or loose stool or you're just a gurgly. Have you ever noticed your dog or your cat having the same conditions? Like they're so in tune with us, which is really important for us to take care of ourselves and not just like let it go to waste every single day, because that's actually going to be the number one thing that helps our pets. When we take care of ourselves, our pets will feel more calm and their immune systems aren't kicked into that sympathetic overdrive where they're just releasing cortisol all the time. So that's number one, get your routine down. Number two, take your gratitude breaks. So every morning when you wake up, what 3 things are you grateful for? Remember that. Check in at lunchtime. Set reminders in your phone for that, like 3 words or whatever it is to pop up, to set an intention and remember to be grateful. So it could just be gratitude. It could be presence. It could be joyful. Maybe it's brave. Those are some of my words. How do I continue to serve and be a positive force in this universe through all the negativity? I know this has nothing to do with animals, right? But it does. because this is going to help your pets indirectly. And finally, what does your diet look like? This goes for you and your pets. Is it turned into like a free-for-all, like, you know, I just eat 12 hours a day now, like the food's there, I'm comforting myself. So this is where routines and like gratitude and checking in and being present will help you from overeating and using food as comfort. Because at the end of this, whenever that day comes, you don't want to have to go and get a new wardrobe, right? That's expensive for one. So if you haven't been working, no, you don't want to have to go and buy all these clothes. But also, are you putting those things into your body that are supporting your health? Are you eating fruits and vegetables? Are you getting, so we did a blog post this past week on, or in the past 2 weeks on the top 11 foods that help reduce anxiety. This is for you and your pets. Get the salmon in, get your blueberries in, get your leafy greens in. And when you're doing that for yourself, feed some to your pets also, because those are great foods that help reduce stress levels. They're going to increase tryptophan levels, the serotonin levels go up, and people feel more calm, and your pets feel more calm too. We also talked about CBD on our past kitty stress webinar this past week. And so using some supplements and things that can help calm down your pets also will help calm down and improve their immune system and keep it from overreacting and being an overdrive and stimulating all that cortisol. Because over time, if we stay stressed, we can lead to other diseases. Like inflammation can result from cortisol being high in the body for a long period of time. That inflammation can lead to autoimmune disease, can lead to cancer. And we don't want any of that to happen. I know you guys don't. That's one of the biggest fears I see with pet parents. Maybe you've been there. I have. I've had 3 pets with cancer. I don't warrant that on anyone, especially their pets. So think about what are the things that you can add into your daily routine that include gratitude and presence and include your diet that supports your immune system. All right, that's going to help prevent COVID. That's going to help you get through this crisis. It's going to make you feel better. It's going to help you come out on the other side. So if you are watching and you have questions, I'm going to just move the screen a little so I can see if I have questions over here. Type in your questions and comments below. I see one here. Let me take a look at it. Oh, yes. Okay. So Andrea, thanks for joining us. I can't tell if you're still here or not. But so we have a sweet pregnant kitty that visits us in our backyard daily. Oh, should we take extra precautions to protect us and our indoor cats? So what I would say in terms of that, so a lot of people, if you are feeding, you know, your outdoor kitties that are strays or ferals, like, you know, good on you, because there's no one else to take care of them, right? So what you can do though is make sure you wash your hands first, wear a mask just in case. So if you're coming into contact with them, if you are petting her, it sounds like she's really sweet and, you know, pleasant. So you probably are. If you're petting her, make sure you wash your hands afterwards, and then make sure you're keeping your indoor cats inside and away, because there's other diseases that are more like prevalent that can be spread, like FIV and feline leukemia. And so if your cats are coming into contact with that, so feline leukemia is spread through saliva. And so that is definitely spread more easily than, I would say, you know, COVID. Remember, with cat to cat spread usually has to be a really, really high amount of virus. So it's something like, keep it in the back of your mind. Do what you would do if you were coming into contact with your own pet and like pretending that you have COVID. So wash your hands before, wash your hands after. If she gets up on you, or I don't know, the interaction, then just change your clothes before you have contact with your other cats. So that way, if the virus is on your clothing, you're not potentially spreading it to them. Most likely, she probably doesn't have it because she's not in a household potentially being exposed to a high degree of virus. So what other questions do you guys have in terms of like immune health for your dogs and your cats? COVID in general, knowing that, yes, we have our animals are testing positive in the US for it. which I'm not super surprised by, but keep in mind too, the rate is very, very low for the amount of people. So let's look at, we're almost to 1 million diagnosed cases, that's tested positive cases. So that number is a lot higher than that, like guaranteed. And who knows what it is, but it's higher than that. So we're most likely way over the 1 million mark for people that have been exposed and have had it, but maybe didn't know, or it was just very mild, and their pets have come into contact with it and have shown no symptoms. Or pets did show symptoms and it was very mild and they recovered. So we're not seeing any pets pass away from it, but it is something to be aware of, because remember, viruses can mutate and change, which makes it really difficult to control potentially. All right, I have a question from Ryan. Does COVID have lasting effects on cats and dogs? So good question. I mean, we have no idea. So coronavirus, let's go back to, so the most common cat virus, coronavirus, there is FIP. So feline infectious peritonitis. This causes major health issues in cats. So there's 2 different forms. There's a dry and wet form. And if your cat gets this, like it's really hard to treat. They get really sick and they usually end up passing away from it. So COVID-19 is not behaving like that coronavirus. It's a different strain, even though it's in the same family. So remember, this is a large family of viruses. So we don't know. I mean, they're showing that with some of these cases that have been diagnosed with COVID in people, there are lasting side effects. Like that's why we need to do everything we can so our immune systems are strong and healthy. So if we do come into contact, we're not going to throw a clot. We're not going to get really sick. Maybe we get a runny nose and you get like a dry cough for a week, but it can be really devastating and really hard on the immune system if you come down with it. And you don't want to, if you can do all that you can, if today's the day that makes you want to start moving more, eating better, taking your vitamin D, vitamin C, your zinc, all of those things that can help you improve your immune system. So start now. There's no better day than today. All right, let me see. Any other questions from anyone that's on? Not seeing anything. So I appreciate all of you for being here for our weekly COVID Critters and Coffee Talk. We'll be back next week at 10 a.m. Mountain Standard Time. So join us. We'll do this again where we're sharing on all the screens. So sorry if I'm like looking all around, but I wanted to make sure this was available for everyone and the different platforms. And make sure if you have any questions about your pet's health, you're just worried, like maybe there's something more that we can do, or am I doing enough? And there's that fear and worry that, I just feel so alone in helping my pets. Give me a call or send us an email at katie@thenaturalpetdoctor.com to see how we can partner and help you, because there is a way, and I'm here to partner with you and help you. And also make sure you check out, we have a 2-week free trial for our Healthy Paws membership, and all our videos go in there. So all these live videos that we do each month, you get to be on live, of course, and then also you can watch the replays. You can see all the old ones. So when I talk about CBD and you're like, how do I use this? It's all there. It's right there. If you have a pet with allergies, it's there. So stay tuned for those, but check that out. I'd love to see you in our membership and joining our Natural Pet Tribe community. We have a members forum where you can ask all sorts of questions to other members that are dealing with the same things that you're dealing with your pet. You can get the support from me and other pet parents just like yourself. So I'd love to see you guys there. I'll put a link for that below in the social media sites. And if you have any questions, never be afraid to reach out. All right, have a wonderful weekend. Get out and enjoy that beautiful sun. If you have sunshine where you are, start eating healthy. Remember gratitude and take care. I appreciate all of you.
Hey pet parents, it's Dr. Katie. I hope you enjoyed this episode. If you did, can you do me 2 simple favors? Number 1, share it with someone else. And number 2, subscribe to this channel by clicking down below so you can continue to get updates every time I release new videos to help your pet thrive. Also, if you're wondering how your pet can achieve optimal health and listening to our videos made you wonder if this can work for your pet, we have an amazing membership site that can really help your pet thrive naturally by being a part of our incredible community of pet parents like yourself. Maybe you're here because you're tired of not having other options to help your pet live their best life and feel amazing. Or maybe you're here because you feel alone in figuring out how to help your pet holistically. Let's partner together today and take the worry out of caring for your pet so you have many more days to share the joy and love with them. Click the link below to grab a 2-week free trial on our Healthy Paws membership. Look forward to seeing you on the next video. Until then, remember you're not alone in helping your pet thrive naturally and live each day to their fullest potential.